wasn't born in New Orleans, but I'm a New Orleanian. My father's the baby of 12 in this city. He was born on North Johnson Street. North Johnson Street was one of the flooded areas in town, but I actually saw people cleaning that house out. And my mother delivered 12 children in that house, gave birth to 12 children in that house. And 11 of those 12 children survived, which I think is remarkable for the time. And there were ditches in front of the streets at the time where that's where people got their crawfish. So when it rained really, really hard and the mud bugs came up, people would go out with baskets and collect them, and that's how you got your crawfish. So you didn't get your crawfish from China. And I've been all over the United States as a kid growing up, and to give you some perspective on my the things that were life-changing kinds of experiences when I was in grade school, I was in the middle of the civil rights movement, literally, and integrated a white Catholic school, of all things, because even the Catholic schools were segregated. And I can remember when the 3 young men in Mississippi, I was actually in New Orleans when the 3 young men in Mississippi were murdered. So I've lived through times when there was an extreme amount of tension. Obviously nothing to the extent to which my parents experienced, but where there was an extreme amount of tension. And in areas that were clearly white, clearly segregated. And New Orleans has a fascinating history. How many people really understand the history of the city? Anybody ever hear of an octoroon and a quadroon? New Orleans was one of those port cities where it was very obvious, because there were lots of blacks and whites, that when people had mistresses or had relationships out of wedlock, that you created this mulatto collection of people. So, which is why you have people who look as fair as you, but have very curly hair, and people who are very, very dark with very straight hair, like many South American people. And when I say South American, dark-skinned South American people with straight hair, I'm sort of really freaked out, because you have this set of expectations that you build in your mind about almost everything. And the expectations really are unreasonable, because they're usually, and if you consider yourself an educated person, the expectations will always get you into trouble. Always get you into trouble, because you'll open your mouth and either make a fool of yourself, or you'll ask a question and you'll go, oh, I didn't realize that. And I claim to be a victim of those kinds of things too. You'll have to pardon me, but my screensaver is the "Let the good health roll." If anybody knows how to say it in some proper Spanish, please help me, because this is terrible. I don't know. It's very literal. So I came from Brooklyn, New York, from a mixed community, and was raised in North Carolina in very much a not mixed community. And I went from a community that had Jews and Italians in the streets, or as part of my neighborhood, to one where I was the fair-skinned kid with the long pigtails who lived in the big house. My father had the fortune to be able to buy 3 houses on 3/4 acres of land. And the 3 houses, 2 of the houses we rented. So of course I was the privileged kid because I lived in the big house. And this was after living in Brooklyn in a flat, in a brownstone on a 1-floor flat. So it's interesting how perspective can give you some realization that you could be on the top of the heap or the bottom of the heap. Now you may not figure, I'm getting to something. There'll be a moment of, it'll all come together. But what I'm trying to say is that there's things that seem to collect into an experience. You build up all of these things, and they collect into an experience where all of a sudden you have to use all of these things, every single one of them, in order to get out of a jam. And that's what the Katrina experience has been for me. So that's kind of my background. And I actually was happy to find that there was some big shot, and this is in Peter Watson's book, A History of Ideas, who said way long before me, is to learn everything that there is to learn, that you become exposed to, because you will find some use for it. And I'll give you a couple of examples of that. Where's my buddy Khadijah?
I don't know. Do you want me to call?
Yeah, call Khadijah. Khadijah and I have a special connection. We actually got through the Superdome together. I am a northerner, carpetbagger type. My parents moved north, and I went to Princeton undergraduate and Yale Medical School and School of Public Health. And I was exposed to real radicals like George Silver and John Thompson and Ruth Romer, who's still around, and some other very activist individuals who came out of the 60s, out of the Johnson White House, Johnson administration, and through some very terrible times. If any of you remember the DRG system, I remember when Kay Kaiser was working on the research for that. So it is true that there is health services research that can become public policy and sometimes become really well-hated public policy. So, it was a very interesting time. And when I decided to go to school, it wasn't clear to me if I was going to school to be a doctor who was going to work in the public health or be an administrator who could understand medicine. And it's become clear to me now that I want to be an administrator who understands medicine. I came to public health around the corner. I finished medical school. I was advised to go ahead and get my boards because nobody respects a doc without boards. And that is true. And it doesn't make sense to me, especially if you're a thinking, breathing person who wants to be an administrator. But that is true. You mean you're not certified? It's like, what am I going to do? Except to know that the pancreas is connected to diabetes right now, I really could care less. I want to know how many normal hemoglobin A1Cs there are. That's all I care about in the universe. But I went and I did internal medicine, and I ended up in administration almost immediately, which is not hard to believe, I would guess, at a neighborhood health center in Cleveland because I was a National Health Service Corps scholar. And back in the day when the National Health Service Corps was around, you could get your education paid for if you actually went to underserved communities. And so I got to actually work and become an assistant medical director for a very large, several clinic, not so very different from the health department right now. I became the director for those clinics. And it was very interesting to be surrounded with the best and the brightest. It was when the National Health Service Corps was really pumping people out. So there were 8 of us there. And we were all frustrated with the fact that we couldn't get simple things taken care of, like supplies, like billing, like why do we have to, like things that seemed to make sense. But as I look back at it, we were actually in much better shape than we are now. So I came to public health through that door, then through running an urgent care center, getting married, and wanting to be a wife and mother, and then working for the dark side of the force, which is the health insurance industry, for 10 years. And I worked for 2 very large companies. I won't say them out loud because now that I've indicated that I'm on the dark side of the force, it could be held against me. But there were very large companies with huge resources, including huge volumes of claims data. So I got to learn how to do 2 things. I got to learn how to whip around in Excel, and I got to learn how that claims data can actually become a very forceful medical record. And you can actually use that claims data to determine whether or not you have consistency in the use of certain medications. Tests have been done, hemoglobin A1Cs, blah, 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 that sort of thing. What's interesting and powerful about that is that they're not willing to do anything with that but to sell it to its employers. Would propose to try to convince you that they saved you some money and describe a process, but they wouldn't want to really sell it to companies or develop case managers that could use sophisticated systems like that. One company actually has a less sophisticated system and therefore a less intense process to manage medical costs, but it really gets down to managing the individual. So if you can manage an individual's hemoglobin A1C and keep them out of a hospital bed, you may be in fact saving tens of thousands of dollars on a case. You just sum up your cases and you can save lots of money. See, so the little things mean a lot. And I remember saying something like that to my boss when I was working back in the urgent care before that. And he says, Dr. Franklin, you're very, very stuck on detail. If you ever want to be an executive, you have to get away from detail and work with high-level numbers. And I told him, okay. But my body language was, I'm not going to listen to you. Because when they say the devil is in the detail, they're absolutely correct. And if I want to know how many people who had normal hemoglobin A1Cs, it would be nice to know how many of those also had cancer, how many of those also had other diseases. And I was finding in the health insurance industry that actually those diseases were being monitored in silos. See, so, heaven forbid that your brain would be connected to your body. Heaven forbid that your body would actually have more than one disease.